Neighboring Trinidad and Tobago recently reported 2 confirmed cases of monkeypox, actively forcing Shadow Health Minister Dr. Karen Cummins to call on local Health Minister Dr. Frank Anthony to be proactive in devising an effective and efficient response to mitigate the effects of the disease should it make its way into Guyana. Noting the proximity and frequency of interaction between Guyana and Trinidad, Dr. Cummins said the threat of the disease migrating to local shores is very high. However, according to Dr. Anthony, his ministry already has systems in place should the threat become a reality.
We have systems in place. So we have the testing capability, we have a response team. So if, let's say, there's a suspicion, because what we do, we write out what are the things that doctors must look for. And that has been sent to all our physicians.
The local health sector has the expertise to manage the virus and has activated systems to ensure that anyone displaying symptoms can be managed, Dr. Anthony assured, adding that surveillance has been activated at the country's ports of entry.
Every one of the airports and these ports, we have a team that is there monitoring. And if there's any suspicion, then they will be able to alert the system. And we take precautions.
Last week, Jamaica confirmed that some of the island's major hospitals are being flooded with patients with respiratory illnesses, including COVID-19. That country's health minister, Dr. Christopher Tufton, admitted that the island is experiencing a surge in COVID-19 cases and advised that mask wearing resume in some sections of the island. Dr. Anthony told this newscast that the situation is being closely monitored by his ministry and called on all citizens, especially the elderly and those suffering from comorbidities, to continue to adhere to the COVID-19 prevention protocols and guidelines.
We have been monitoring. We continue to have our COVID team monitor. We continue to collect data pertaining to cases. And occasionally we do have a few persons who come into a hospital. We need persons to take precautions. So if you're older, one of the ways that you can take precaution is that you should get your booster doses. We have those doses available to people, and I would encourage those persons who are vulnerable, especially older people.
While Dr. Anthony did not confirm or deny whether Guyana has seen an increase in COVID-19 cases, this newscast was able to ascertain that there has been a slight uptake in persons testing positive for the virus. The Ministry of Health has failed to disseminate a COVID-19 dashboard since June 30th. Renata Burnett, reporting for the HGP Nightly News.